This procedure that you are currently watching is called assisted mouth care. Assisted mouth care. For you to understand it better and follow it well, you must go back and view the previous video posted on the requirement of assisted mouth care. You must first and foremost explain procedure to the patient. Procedure must be explained to the patient, seek for patient consent, and then from there you wash your hands, and then you arrange your items very well. Make patient comfortable, put patient in the sitting up position. Then you place towel and that's Macintosh and towel under the chin of the patient for protection, just to protect the patient. Then you give the patient brush with paste or maybe chewing stick or chewing sponge. That's what you give to hot patient after you have protected the patient with a um, towel over marking hot touch. Then you then encourage the patient to what to brush, right? You encourage the patient to brush. So what you are seeing now is that that's Pepsodent toothpaste and brush given to the patient is going to add water. Okay. Then you begin to encourage the patient to brush. Patient will rinse the mouth and then void it into the receiver. So you are encouraging the patient to brush the teeth. You ensure the patient clean the mouth thoroughly, and that should be done very gently. Inside the cheeks have to be clean. You direct the patient. Both sides of the gum have to be thoroughly clean. The teeth has to be cleaned. The tongue has to be clean, and then the palate also have to be clean. So what we are seeing now, or what you are watching now, is the cleaning or thorough cleaning of the mouth, inside the cheeks, the two sides, the palate to be clean and what have you. Then you give water and mouthwash and then let the patient void into what the receiver. That's what you do when you are sure that patient is done cleaning. Then you give water, patient void into that receiver. That's the vomiting bowl. Yeah, that's fine. Then from there you rinse the brush, you rinse it so nicely. Then you give the patient clean the mouth and the water around with tissue that you have paid. Tissue that form part of the requirements. Patient keep voiding the water into the receiver. Then you must get your petroleum jelly lubricant or Vaseline. If you don't have the petroleum jelly, you can have the lip gloss. This day we use the lip gloss on the lips, and then you take off your towel over the small Macintosh, and then you will now go ahead. Uh, if the patient asks for mirror, you give the mirror to the patient to look at how clean and neat the lips has what become after pasting. Then you thank the patient for the procedure. You thank patient for allowing you to perform the procedure on her. Then you make patient comfortable or put them back into their original position or comfortable position. Protect them well. Make them comfortable. Make them comfortable. Make them comfortable. That's it. So they are now making the patient comfortable in bed. Uh-huh. After making the patient comfortable, you discard your items. You take off your screen that provide the privacy, and then you can now sit down and then you document. You get to wash your hand and then come and document your proceedings. So you record the